It is recording, and we're going to go back to the video. Thank you.
For the 100,000 individuals on the transplant wait list, nothing could matter more. Voices for Kidney Health advocates have worked in 25 states to enact laws that make sure living donors aren't denied life, long-term care, or disability insurance after donating a kidney. But now it's time for Congress to pass a federal bill to ensure that no living donor faces insurance discrimination or risks losing their job because they chose to save someone's life.
Passage of the National Living Donor Protection Act would remove one of the most significant barriers to organ donation, insurance discrimination.
Living donation is the best treatment for patients with kidney failure. The more donors we have, the more lives we can save.
The insurance industry is increasingly supporting living donor protection acts. If states and businesses are coming together to support this legislation, it shouldn't be that difficult for Congress as well.
The National Living Donor Protection Act would protect those who are willing to give the gift of life.
Now is the time to protect living donors nationwide. Join the National Kidney Foundation in asking Congress to pass the Living Donor Protection Act.
So as always with our videos and really everything we do, our objective is to put our advocates front and center. We know it's their stories and their unique grassroots power that can move the needle as we're looking to advance legislation and improve public policy. And so that video, I think, is a really great example of how we work to do that. It is up on the National Kidney Foundation YouTube feed. We deployed it on our advocacy Twitter account. And certainly if any of you know of ways that you might want to help us to get that video out there further, to amplify it maybe at an event that you have coming up or just on your own social media feeds, on your website, in one of your newsletters, we will be sure to include a link to the video file itself in the follow-up notes that we will be sending around after the briefing. So the state successes that I alluded to and the support we've been building for our federal LDPA are two major talking points in the release that we put out on June 1st, celebrating the 1-year anniversary of Voices for Kidney Health, our advocacy community and brand. I did a very extensive Google search, and no less an authority than goodhousekeeping.com tells me that the first anniversary gift is traditionally made of paper because a couple's lives at that point are a blank slate. I got to be honest, even for me, that is incredibly cheesy, but that's okay because for Voices, it is anything but a blank slate. We have a whole lot of accomplishments that we are celebrating and that our advocates and that so many of you have helped us to achieve, some of which you see here. I'm not going to read them all, but it definitely gives you a sense of the range of what we've been able to accomplish together. And it makes me feel very, very encouraged and bullish on what we'll be able to do in the next year as we work to advance our kidney health agenda, both here in Washington and in so many of your state capitol buildings as well. As part of Voices, we have, of course, our Voices website at voices.kidney.org. And this is our action center. It's really the hub. It's the center of that website. And I just wanted to provide a quick reminder that you always have opportunities here to activate and engage your supporters and potential supporters. And once they've taken action on any of these, then they're already part of the Voices community, which of course we are always looking to grow and which we did grow in the past year. We added about 1,000 new Voices for Kidney Health advocates, which we're very excited about. The alert I have highlighted here on the bottom left is one that we recently added and sent around an action alert about just last week, and it pertains to the Health Equity and Accountability Act, which was introduced in the House of Representatives back in April. We are particularly excited about this bill because of the fact that the sections that focus on kidney disease in the bill and how we can best address the health disparities that we all know continue to plague our kidney patient community are sections where we had input, where the sponsor of this bill, Congresswoman Robin Kelly, came to us and said, can you please provide some of your expertise? What would really help to promote more kidney health, more health equity in the kidney community? So really a testament to us being a trusted voice on Capitol Hill. And that, of course, is down to our Director of Congressional Relations, Lauren Drew, who you're going to hear from in a little bit. So we added that recently. This page is constantly updating, always more opportunities on there. So just again, a quick reminder that our Voices Action Center is always there for you if you're looking to do a little activation and engagement. So speaking of advocacy campaigns, we had a number of successful ones at the state level, and those are highlighted here. This is the one other update to our Voices website since we last spoke that I wanted to make sure we mentioned. It is a refreshed look at all the progress that we've made in passing bills at the state level. This is something that our outgoing advocacy manager, Allison Harity, was able to get up just before she departed. And as you can see, it's a little more detailed and a little more comprehensive than it was before. If you hover over a particular state, like Minnesota here, you get a snapshot of all the bills that have been passed, as well as some other legislative areas where maybe that state hasn't gotten to it just yet. So not only can users feel really great about how far their state has come, all the progress that's been made, they can also see where there is still some work left to do and perhaps be inspired to start or join a state advocacy campaign of their own. So speaking of advocacy campaigns, we are, as mentioned, at the conclusion of state legislative sessions. They generally run, for those that aren't year-round, they generally run from January to June. And this year, states that include Delaware, Georgia, Florida, Louisiana, Minnesota, Nebraska, Ohio, and Virginia all passed kidney policy bills. Primarily living donor protection acts, but we also saw a chronic kidney disease task force bill pass in Virginia. And in Georgia, we also had some tax credits become law for both employers and employees to incentivize living donation. So with all of this, we thought it would be great to hear from not one, but two state-based staff who oversaw successful campaigns. And we're going to start off with Mallory Olson, who was our incredible executive director in Minnesota. Mallory?
Thank you. That's so nice. Thank you, Matthew. Well, first of all, congratulations to everybody on this call. 28 states is huge. So we should all be proud of this shared success. So 4 years ago, shortly after I started at the NKF in my role, the Living Donor Protection Act was introduced in Minnesota. And I will admit that our local team most definitely were all novices around advocacy efforts. But flash forward to 4 years later, we really were able to line up all the right players and finally get the bill signed into law this past month, which is very exciting for us. But along the way, we definitely faced many challenges because of divided government in Minnesota and a very intense political division in our state, which I'm sure many of you have as well, given the climate. But I do have a couple keys for success that worked for us. I hope might be useful for anyone on this call that has not yet launched an advocacy campaign. So my first sort of key to success is really around lobby days. Lobby days are a must. They are absolutely critical. And if you're not doing them yet, I highly suggest you start doing it this year for many reasons, but I really don't think that you will have as much success with passing legislation without doing lobby days. So if you are going to do them, obviously check in to see when your state legislative session begins and plan to do something towards the beginning of the session to give you enough time. And that requires some outreach roughly about a month in advance. And again, I will tell you 100% that we would not have uncovered the kidney connections amongst our legislators without lobby day. We kept careful notes from the last 4 years of doing these events of who had kidney connections and shared those with the government relations office too. There were tons of them. We were just shocked. Shouldn't be that shocked because of the prevalence in the general population. But I mean, whether they were kidney patients themselves, had family members, were living donors, lots of connections to kidney disease. So that alone was very important. So I would be happy to provide any advice or assistance with anyone that needs help coordinating a lobby day. And I know that Matthew and the GR team are also very happy to help, as well as they definitely have helped us in joining trainings and making sure our advocates knew what they needed to know. My second tip is to build an army of advocates. Obviously, we've got the Voices campaign, but an army on the local level, at the state level. And when you build that army, think about appointing a general. My general's name was Jen. She's our board chair. She's also in the KO team. She's a living donor and happens to work in the insurance industry, which was key for us around this legislation. But let me step back a second and talk about building an army. So over the last 4 years, we worked really hard to incorporate the messaging of joining CAC, joining KO into everything that we did. Anytime we talked to a volunteer, we brought this up, and we still do. And we were so surprised. People really jumped at the opportunity to do this because, as you all know, it can be a little daunting if this isn't your day-to-day job. So if possible, try to work in a good mix of people, whether it's patients, family members, healthcare professionals. A good solid mix of background is really helpful, but really it could be anyone who's passionate about changing kidney disease and policy for the better. We held monthly, which was a lot, monthly advocacy meetings the past couple years to keep everyone informed of what our staff, our office was doing locally, so that they could turn around and share with their lawmakers and keep those connections fresh, and just make sure that they have something to talk about when they go to meet with their lawmakers, and just to keep everyone apprised of what we were doing on an advocacy level too. So again, going back to appointing a general, my general was Jen. She absolutely was my number one key to success. Like I said already, she's works in the insurance industry, and she really helped us pass this bill. Without her, I don't think I would have had the time to do it, frankly. We all wear many hats, and this is not my only job. So when I didn't have the time to follow up with a legislative aide or a lawmaker or whomever, deputized Jen, she did it. She knew what she was talking about, thanks to good training from Matthew and his team, and then us staying close. And she really made this happen. Again, it took 4 years. We had so many challenges. She also worked really hard, and this is my third sort of takeaway. She worked really hard with us to establish new relationships in the insurance industry. She made a really great connection at the Minnesota Insurance Federation nonprofit, a lobbyist who's really the key to those relationships with the various lawmakers, but also just understanding how the political system works in our state, which every state is different, but that was so helpful for us just to be able to ask those questions that are unique to our state, just to have somebody to ask those questions to. It also allowed, so in addition to the Federation lobby group of Insurance Federation, we also leveraged our relationships with other organizations. So DaVita and Fresenius, they all have government relations staff, and we were able to, have a reason to talk to them and collaborate on something that they felt good about helping with. So that really helped strengthen some of those relationships too. It took a lot of work. I'm so grateful to Matthew and the team for all of their assistance. And I know there's 27 states before mine that were able to make this happen, but we're really excited to hear what's next and what we can start working on in 2023.
Thank you, Mallory. And congratulations again. It's so great to see all that hard work pay off over a pretty long period of time. I so appreciated everything you said, but just a few points. One, delegating, getting those your little core and your general is key to any successful advocacy campaign. But also, then these are folks that you can deputize and delegate to, and have them sort of carry the banner for you. That's so key. Plus, that's who lawmakers, that's who they want to hear from, right? They want to hear from the constituents who are going to hopefully reelect them, right? You mentioned divided government. This picture is from the signing ceremony, which I know your Democratic Governor Tim Walz signed the bill. The next state we're going to hear from is run by a Republican governor and a Republican legislature. I think one of the great things about the Living Donor Protection Act, and really anything that we try to work on in terms of bills, is that they are bipartisan in nature, right? Of course, kidney disease does not discriminate based on party. And so too, our legislation tries to really, make sure it's set up in a way that it can be embraced by folks from both sides of the aisle. That's always really key. And then finally, with the lobby days, we are here to help. I definitely would like to underline that. But just like with our Kidney Patient Summit that we do every March, you can do one-on-one meetings, one-offs here and there, but having all your advocates together, having a bunch of meetings on the same day, ideally, is really just second to none in terms of building visibility. And so it is absolutely something that clearly can lead to really successful outcomes. So again, so appreciate all your hard work paying off and your perseverance over a pretty long period of time. I would say that's pretty much the standard. It often takes a few years over several sessions to get bills passed, but that is not always the case. It was not the case in the great state of Georgia. So our second speaker, Kara McKinney, our executive director in Georgia, is going to tell us a little bit more about how things came together there relatively quickly. Kara?
Hi, I feel like Mallory had a marathon and we had a sprint.
Yeah.
And so both had the same end result, but we got there completely differently. So we have a senator here in Georgia, and his son was 24 and just got acute kidney failure. And so he donated his kidney to his son. And after his experience, he really wanted to change the laws and to have an impact in the kidney community because it wasn't as easy as he thought it was going to be, right? So he reached out to us and to work together to get the Georgia Gift of Life bill passed into law. The points that we want to talk about was one, just keeping in regular contact with him. Like, we could not have done this if it wasn't for Matthew and Allison. Like, they were instrumental in our success. So please, like, lean on them. They are the experts. I am not the expert in this part of our job. And so they really helped navigate the system and also helped continue the conversation with the senator. So one of the things that we were able to do was ask the senator to be on television on Fox News so that he could share his story and then talk about the bill. And I would definitely say utilize your media contacts because they're politicians. They want to be on the news, like, in a good way. So definitely have that lined up. We were able to get him on a morning show. He was able to share his story, talk about it. It was a really good opening for a relationship with him and our media contacts. So definitely have those lined up. And if you don't have media contacts, like, just go ahead and start trying to get those relationships. We have on our board, we have someone, we have someone in radio, but also we're bringing someone on our board that is an anchor on Fox 5. So utilize those relationships. And if you want any help with that, like, maybe give me a call and maybe we can have our board members make some introductions for you because they know people that we don't know. The next thing to talk about would be, for us, it went really, really quickly. So I would say always try to be ahead of what's going to happen, because what we saw with, he would be like, oh, can we have someone speak tomorrow? Wait, what? You want us to have volunteers queued up for tomorrow? So when we did that, we went ahead and set them up for the next couple of rounds so that when the next time he asked for a speaker or a volunteer, we already had that set up. And we're very fortunate to have Anthony Tuggle, our national board chair in Atlanta. So he was able to meet with him one-on-one, which was fantastic. And also he was able to be part of the press release. And so definitely have your volunteers ready to go. When we first started, I did not expect that we would need to be like a 24-hour heads up, but apparently that's how it works. So I was surprised, but we had them lined up for the next couple rounds. And then I would say just really send out the advocacy alerts. We really relied on Matthew and Allison to get those out because once again, they are the expert and to rely on them. So ours was a short sprint, but we were sore from it, I tell you.
Thank you, Kara. So appreciate that. Yeah, I definitely, so a few things that jumped out with you. I can't remember who it was who saw it first. There was obviously the story about the senator and his son. But whoever it was, we noticed it. I think it was last summer, not long after it actually took place, the donation. And once we saw that, we got to work. So definitely be attentive. Via Google or however it is, just monitoring your media in your state and just taking note of any time you see that an elected official has some sort of connection. I think Mallory actually, speaking of Jen Anderson, emailed me the other day and mentioned that in all of this work that y'all were doing, she met yet another lawmaker who had a connection that I don't think we were familiar with before. So for the next campaign, when it comes up, we'll definitely work to leverage that. And then if you have that, if you have that lawmaker, they probably have a story, right? And just like with your advocates telling that story, it's almost certainly going to be a very powerful one. And so leveraging that, as Kara you did with your Fox affiliate down there, was so great. And again, not every state by definition can have the national board chair. We realize that, but you almost certainly have someone in your state who is on your board or who is, a VIP of one kind or another, who are always, pretty well positioned to talk with state lawmakers who, consider themselves to also be VIPs. Fair enough. And then again, just can't underline it enough. We are here to help with alerts, with setting up the press statement for when, fingers crossed, we actually pass the bill. We are here to do that. We do that with a number of states. And so we are very happy to work with you on that. So thank you again, Kara. Thank you again, Mallory. That is what's been going on at the state level. And now we're going to turn our attention to the federal and the congressional. Lauren, I'm going to pass it over to you. Lauren, Lauren, I think you might be on mute. Yes. And you are.
Oh, or I could unmute myself. My apologies, everybody. So I wanted to just check in on a couple things we had talked about last time and update you as to where we are. So as you know, we were talking about appropriations, and that's the annual process by which the government basically determines its budget priorities. And as you might recall, our priorities are funding for the Chronic Kidney Disease Initiative at CDC and for kidney-specific research in NIDDK at NIH. So we completed the first round of that, which is basically you all helping us take meetings during the Kidney Patient Summit, and then us filling out a whole pile of forms and asking members of Congress to support those requests. Now the members of Congress take all of that information and they're behind closed doors drafting these bills and trying to put all that information into something useful. So towards that end, we did circulate a kidney funding letter around the Hill, just reminding them that these are our priorities. And we got 82 members of Congress to sign on to that letter, indicating that they support those priorities. And that letter then goes to the people in the room writing the bill, so they can see not only does the wider community support this, but 82 members of Congress have also said that they support this. We've also submitted standalone and group testimony. So NKF has submitted testimony, but we've also partnered with our friends at ASN and other kidney organizations to submit some group testimony as well, just to show how broadly these priorities are supported and continue to check all the boxes that you check to make sure your priorities end up in the final bill. There's still back and forth and negotiations that needs to happen. If you know your Constitution, all of these bills that involve spending have to originate in the House. So the Senate then goes a little bit after the House gets their draft out. So we'll be looking to see when that happens, and we'll be comparing to see if the House gives us any money, if the Senate gives us any money. Sometimes the House gives you something and the Senate takes it away, which is always fun. But we'll be monitoring that throughout the summer. So we'll keep you posted, and we'll keep our fingers crossed to see how we do this round of appropriations. Next slide. For our other legislative priorities, we did mention the Living Donor Protection Act, and I do just want to reiterate that video is a great thing if you're looking for a reason to reach out to a member of Congress, or maybe you've never connected with them before. You can share that video with them and just say, hey, want to let you know that we support this bill. We really would like to see it move this year, and use that as your way in to start that conversation. We are doing great on co-sponsors for LDPA. You can see we have over 160 total sponsors, House and Senate side. And so right now we are kind of waiting for the committee that has jurisdiction over LDPA to get it on the calendar and get a hearing, because getting a hearing in Energy and Commerce is really that next hurdle we need to get through if we want to pass it this year. And not to raise too much of an alarm, but if we don't pass it this year, it's a new Congress next year, everything goes back to zero, everything resets, and we start over, which nobody loves doing. It'll be the fourth Congress, I think, for this bill. So whatever we can do to get LDPA done this year, whether you want to do, letter writing campaigns, you want to host an event at your local office, we're going to do August meetings with advocates, any ideas you all have to either engage lawmakers who have not yet gotten on board, or very importantly, those lawmakers that are on the Energy and Commerce Committee that need to make the decision to have a hearing on this and help us move it forward. I'm looking at you, New Jersey, some of those really high priority offices. Let's talk about some stuff we can do to really elevate LDPA on the list of priorities for the Energy and Commerce Committee. We are still working on the Home Dialysis Act. I know we've only got it introduced in the House. I'm working hard to get a Senate introduction. So anyone out there, Senator Lujan's office, Senator Durbin's office, Senator Tester's office, those are the offices I'm talking to right now. So hoping that we'll be able to get a Senate bill for home dialysis in addition to the 18 House co-sponsors we have. And on the transplant equity bill, I'm happy to announce that we actually have legislative text. So we are on to the next step of this bill. We got to cross some T's, dot some I's, just clarify what that legislation is going to look like, and continue to socialize it around the kidney and transplant community before introduction. And maybe we might be able to get it introduced maybe this fall by the time we cross all the T's and dot all the I's. But that's really exciting. That's going to be a really big bill. If you're used to reading the Living Donor Protection Act or the home dialysis bill, they're like, 3-4 page bills. So far, that transplant bill is like 25 pages. It's got a lot going on. So when it's ready, we will definitely walk you all through it and give you the brief version of it so you don't have to read all 25 pages. Next slide, please. Okay, and I think I'm actually turning this over to Miriam.
Sure.
Great.
I'm not sure if Miriam was able to join. I know that she has a call at 3:30 with CDC. So I will walk us through the next few slides in her absence, and I will do a poor man's version of Miriam Godwin, since she is incomparable in so many ways. So just to kind of refresh your memory of how we're approaching a lot of our policy objectives, and just to distinguish, Lauren handles the legislative side of things. Those are the things we're trying to move through Congress. The regulatory and policy things are what we're trying to do within the existing framework. So within CMS, within HRSA, and really across the domains of CKD, ESRD, and transplant. But really it follows the continuum, right? We are really trying to ensure that individuals are screened and diagnosed with kidney disease, so that, we have more than, 10% of people who know that they have kidney disease, and that we can get them into early treatment and management. We know that the earlier your kidney disease is diagnosed, the more likely you are able to access therapies that can slow its progression and preserve your kidney health. The best way to do that, to incentivize physicians to do that, is to measure them on it. So to introduce new quality measures, we are working on what we're calling the Kidney Health Evaluation for Diabetes measure that we expect to be passed this year. And this is a pretty monumental thing, that this would be implemented into the payment system for physicians, that they would get measured on how well they are doing in diagnosing people with diabetes. I mean, it's such low-hanging fruit, right? There are such high risk, yet so many of them don't get screened for kidney disease, and they only find out once their kidneys are in CKD 3 and 4 or 4 and 5. If we can catch them earlier, we can get them into the therapies, especially some of the emerging therapies like SGLT2s that you may be familiar with, and other drugs that really do slow progression of kidney failure. And if you can measure somebody on them and get them reimbursement for it, they're much more likely to do it. And then from a population health standpoint, how can we do a better job as a community of supporting people with kidney disease, either through existing programs. Your state might have a diabetes control program where you could do basic information about kidney disease, where you can work with federally qualified health centers and identify the gaps in your communities. And it may be worthwhile in the future to bring in some of our folks from the programs department who are doing these activities right now, focusing in Missouri and Virginia, and some of you from Missouri and Virginia may be able to speak to them. But what we're really trying to do is position NKF as a convener of these conversations, and working together at this community level to really improve kidney care. And that's a lot of the funding that Lauren alluded to, that if we can get more funding to CDC prevention programs, that will flow hopefully to NKF and to some of your offices to help support this work. But really, the whole objective is catch people earlier, get them diagnosed, get them into treatment, surround them with a community that supports them in their CKD management. Next slide, please. So ESKD, there's a ton more that I could have talked about today, but I wanted to just focus a little bit on home dialysis, since that's really, I think, organizationally where most of our focus is on the dialysis space. Dialysis has been around for a very long time. The providers well, the model well. It hasn't really changed all that much. But what we're really trying to do is drive more access to home dialysis, because we know that's what patients want. Something like 40% of people with kidney failure would explore home dialysis if it was an option, yet very rarely are they counseled on their options for home dialysis. or they don't feel very well supported for it. So we've been pushing some policy changes that we think would expand access to home dialysis, especially home hemodialysis, which, you know, is I think the best opportunity to really expand access to the home. But it's scary. It's scary for a lot of patients, the idea of going home and cannulating it, you know, by themselves, and the risk for infection and the risk for bleeds. So we're proposing some policy changes that both would improve the training that individuals receive in advance of going home on hemodialysis, but also providing some staff assistance. And I mean, just like everyone else, you know, you don't send people home without any support at all, except for dialysis. And so what we're trying to do is provide some resources to support staff assistance in the home, to allow flexibility on both who can train for home dialysis and who can provide those services in the home. We're experiencing a terrible nursing shortage just across the board, not just in dialysis, but everywhere. And, you know, it may not be cost effective to send an RN home with a patient 4 or 5 times a week, but we can certainly send dialysis techs and other people who may be appropriate, who can help with the staff assistance, but have some oversight and guidance from the RNs and the other professionals in the kidney community. So that's a little bit about what we're trying to do in home dialysis. I will caution you, like, this one is a little bit more sensitive. Certainly the nurses are a little weary of something that they could perceive as, you know, kind of encroaching on their job responsibilities, and they don't want, you know, they don't want techs to be doing things that nurses should be doing. And we don't either, but we do think that there's probably some gray area where, with some additional training, with some additional oversight, we could identify more workers, and we all have a workforce shortage. We know about the workforce shortage, could help support patients in their home, and that would really help facilitate better access to home dialysis. So that's just a little bit about what we're working on from a regulatory standpoint. And I won't bore you with the details of how we do this, but know that it's something that we're working on. You can keep going, Matthew, that's fine. And then on transplant, and I think you've all seen this slide before, but it bears repeating because it is complicated. You know, where we're trying to make our mark on transplant, I think, you know, you're familiar with the Transplants for All agenda, which is kind of this loosely defined NKF objective to push more resources into transplant so that people can get access to a life-saving transplant. And we've identified what we consider as the pain points, right? Where could we do better? And at a minimum, far too many people never even make it onto the wait list. They either don't get referred, they don't get evaluated, they don't complete the evaluation, they are declined for reasons that are not clinical, but because they don't have access to transportation or housing or support in the home, things like that. So we really want to make sure that those barriers to even just getting on the wait list are as few and far between as can be. How do we collect better data on transplant, you know, on that process? How do we make sure that, you know, individuals of color, and we know that transplant equity is a big problem, Lauren alluded to that, you know, how do we make sure that we're not disservicing those populations and that racism isn't implicitly part of the system? We definitely need to increase living donation. Again, the racial discordance in living donation is really stark. You know, there's just not a lot of African Americans are getting living donor kidneys for any number of reasons, but, you know, what can we do to grow the number of donors who are giving kidneys, and that people who can receive them, because that is really a preferable option. And then how do we access more deceased donation? You know, there's a lot more organs that are discarded that aren't procured in the first place. There's just room to improve across the board. You know, we touched on discards. It continues to be a priority for the organization. You know, we did a conference a few years ago. We identified some best practices. How can we roll those out? How can we, using the infrastructure that you all represent, the fields, the communities that you all have with your transplant centers, with your transplant surgeons, to do a better job of preventing discard in the first place? And how does the policy environment support that? How do we make sure that, you know, high KDPI kidneys, those kidneys that are, you know, from a 68-year-old and, you know, somebody with high blood pressure, those might cost a little bit more for transplantation. That patient might need dialysis for a few days afterwards. So how do we make sure that the economics and the policy that kind of surrounds that transplant encourages that risk? Because what we don't want to have happen is for that kidney, which might serve that patient very, very well, be thrown out because the surgeon's just a little bit skittish about not getting paid for dialysis. And, you know, really, how do we improve the patient centricity of the whole process? As you all know and have experienced and heard from your patients, it's not a very patient-friendly process. There's a lot of lack of communication, lack of transparency. doctors very paternalistically making decisions on your behalf without consulting you. We really need to make sure that the system doesn't forget who it's there for, and that is for the patient. And finally, how do we drive performance across the board? Much like my children in transplant, like they tend to all blame each other. The nephrologists say it's the transplant center's fault. The transplant centers blame the OPOs blame the transplant centers. Yet nobody's working collectively, or they're not working as well together as they should be because they don't have shared outcomes. So really, how do we get them all pointed in the right direction, measure them on the same test that, they're all going to be judged on how well this patient is getting transplanted, and make sure that the incentives financially align with getting to that result. So I've been talking for a while. I want to pause for a second. I think that might be my last slide. Oh, and then just as an FYI, we did create a transplant advisory committee. Really, and this is something that, NKF has had versions of many times over the past few years, but really to help inform this whole Transplants for All agenda, so that it's not just a tagline, but there's actually some meat to this proposal, that we have programs like the Big Ask, Big Give. We have professional education. We're working on a Project Echo to help reduce discards and improve transplantation, and the policy that all of those pieces fit together. And we need providers, for the most part, just people who have real expertise on health economics and operationally how this all works at the ground level, to help advise us to make sure that we're thinking carefully about this, that we're smart about it, that we're not creating unintended consequences around it, and that all of these different elements, all the different parts of NKF that make us who we are working in harmony towards a common goal, which is getting more transplants. So there, I think, is my last slide. And I guess we will pause here for questions on any and all of the above.
Yes. Definitely appreciate that we went a little bit longer today than we have in past months, but just again, so much to cover, and so appreciate it. Thank you so much for that, Jackie. I see your comment in the chat, and we so enjoy collaborating with you all. And certainly, when it comes to state teams that are ahead of the advocacy curve, it is definitely you all. So thank you so much for that. Actually, I was
They're our children, Matthew. They're all wonderful in their own way.
Yes. Everyone's ahead of the advocacy curve. I did, I connected with Lauren Brown earlier, who I know is a little bit newish. She's several months into joining the Maryland team, and I think she might have had to move on to her next meeting. But when we were talking, I was going through the various things that we're working on. I was doing a sort of a shortened version of what we have in this deck. And then I realized that I was sort of bearing the lead. I just said, we just always have stuff. We always have something going on. We always have stuff. There's Lauren, I see her. We always have something that we are hoping is useful to all of you, that you can pick up and amplify the LDPA video, the actions that we have up on the Action Center, some of, the policy work that we're doing, submitting letters and comments. So like Patty, we value your partnership as well. Last call for questions. Okay, well, with that, I think we are happy to give everyone 17 minutes back, and thanks again for joining us. We'll see you in 2 months.
Bye all.